Okay, so now let's explore a few ideas for working kidney and bladder, triple heater heart protector and liver gallbladder in the back. Okay. Well, Bladder Meridian, of course, is a meridian that we'll be working on every climb. When we're working the Bladder Meridian, what we're doing is we're changing our focus away from the diagnostic areas and the other information in the back, such as the U points, and we're focusing on the whole back, because it's that continuity that gives us the experience of the Bladder Meridian. We can work that in a traditional way by palming and thumbing. We can also use this technique, which is a very nice technique, where we're balancing out all of the individual points and we're working 6 points at a time as we work down. And I'm working the Newenergywork Bladder Meridian here, which is more medial than the traditional Bladder Meridian, where the U points are situated. Okay, so the lower back here is quite often associated with kidney and bladder, and a very nice technique in the side position is to place the mother hand on the lower back or the sacrum, and then we can work points such as bladder 36, the Bladder Meridian, Bladder Meridian, we've got bladder 40 here, very nice point for the back. Bladder 60, another important point for the lower back. Okay, and we can also move round and work the Newenergywork kidney meridian, which relates more to the sacroiliac joint, useful for lower back pain around the sacroiliac joint and the sacrum. So pick it up here, and here I'm working Newenergywork kidney, which is similar to the bladder 2 line in the traditional system. Okay, now triple heater and liver and gallbladder lend themselves very much for the side position, and we traditionally work it in this position. So let's look at some variations of that in the supine position. If you'd just like to move over onto your back, that's good. Okay, if we're working the lower back, we can work triple heater meridian in a similar way that we worked the stomach meridian earlier in the course. We can also use leg stretch positions to work heart protector. And again, I'm doing the same thing as before. I'm tuning into my mother hand in Shakura's lower back, just selecting out subos that help support the lower back. Okay, and of course we can extend that into the lower leg and use points on the feet. Thoracic back issues are often related to the fire element, and the heart protector and triple heater are a good example of that. Here I'm assessing the condition of Shakura's thoracic spine, and I'm going to use some penetrating work on the heart protector meridian. Actually, that feels quite good, doesn't it? Can you feel that?
Yeah, I was just about to say that.
Yeah. Okay, so there's probably a subo right in here somewhere. There we are, that's it. Okay. Heart protector 6, always a useful point. And here we can also work triple heater meridian. Again, assessing its effect on the upper thoracic and shoulders. Okay. So now we have liver and gallbladder. Liver and gallbladder are very important, obviously, with treating the back. And basically, any obstruction or tension in the back can be related to the liver and gallbladder, but of course we would check it first with the resonance technique. Once we've confirmed that some tightness in the back is associated with the liver and gallbladder, we can use the leg in the straight position or take it into the traditional leg stretch position. Gallbladder 34 is an excellent point for releasing any spasming or obstruction in any part of the back. You can also use stretch position for the liver meridian. Again, depending on the client and depending on the resonance of the meridians to whatever the issue is with the back. And again, using the Mas-Naga system, that also gives us enough flexibility to be able to use gallbladder meridian, liver meridian in the arm, just in case liver resonance occurs in the upper back. So in which case we'd use the gallbladder meridian like so. Again, selecting supers out that have the desired effect. Okay, and the liver meridian in the arm. In reality, of course, the combinations of meridians are endless, and we've always really got to go from the reality of the resonance that we feel in the HARA diagnosis, matching that with the information that we get from the client in order to put together an integrated treatment.